Okay, I will be the moderator in this meeting.
Yeah. And
Okay,
you want to read the CV of Dr. Sani?
okay. Now, before we starting the lecture from Dr. Sani, let us hear the speech, the opening speech from our Dean. Please, Dr. Budiono, to give speech and opening this visiting lecture. Please, Dr. Budiono.
Thank you, Pak Farid. Bismillahirrahmanirrahim. Dear Dr. Sandi Manava from Clinical Health Innovation Private Limited, and he also from UNICEF Hyderabad, and Farid Akusifana, PhD, Head of Biostatistik and Population Department, Faculty of Public Health, University Diponegoro, and our colleagues, lecturer from the same department, and all of the participants, undergraduate, master, and also doctoral student. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much for coming and joining in this webinar, education seminar. We know that the global goal of digital health is to promote healthy lives and well-being for all, and of course everywhere and at all ages, and to realize its potential in the level of national or regional. I think digital health initiative must be guided by a strong strategy that integrated financial, organizational, human, and technological resources. Digital public health encompasses the integration of various digital technologies, I think, included tools, methods, and platform, and so on, into public health effort. And digital health is a concept that combines digital technologies with the world of the health to improve quality of life and also health services. And the Indonesian Ministry of Health will try out the use of artificial intelligence technology in 3 leading hospitals in Indonesia. And the use of artificial intelligence technology is to improve the quality of health services in Indonesia efficiently. And Minister of Health also is passing for technological transformation in the health sector, especially for primary healthcare. This is driven by, among others, the development and utilization of artificial intelligence and machine learning technology. I think two big thing, artificial intelligence and also machine learning is very important to support the primary healthcare services. The technological transformation itself is one of the 6 digital transformation strategies proposed by our Ministry of Health. One of the use of artificial intelligence itself is by adopting ultrasound scanning technology in primary healthcare level. And Minister of Health said that the party wants to encourage AI technology to automate ultrasound data analysis in health center or in primary healthcare, and it will spread across various regions in Indonesia. So this is the policy of our government, especially from Ministry of Health. And this AI-powered ultrasound data analysis technology can then help doctors and also healthcare professional capture and analyze data to identify disease in patient and also to diagnosis, including pregnant women. You know that in Indonesia, the problem of related to the pregnant woman and also baby is very high. For example, the maternal mortality and also maternal morbidity and infant mortality in Indonesia still high. And I think including for pregnant women, it's very important, and I think with important detail for diagnostic instrument supporting by AI technology. And today we have Dr. Sani Manava from Flame Care Health Innovation Private Limited, and he also from University of Hyderabad, India, and he will explain more detail and briefly related to this topic, I think. And hopefully you all pay attention and are active in discussing. And because it is very relevant to us as a public health specialist, especially to promote and to prevent the disease, and also supporting and promoting the health status for our community. Finally, enjoy this lecture and success for you. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. With your permission and of course Allah Subhanahu wa taala, this event I officially open. Bismillahirrahmanirrahim. Terima kasih.
Okay, thank you, Mr. Dean, Dr. Budiono. Dr. Sani Manava, before you give lecture, I will introduce you by sharing your short curriculum vitae. Okay, I will open your curriculum vitae. Okay, Dr. Sani, I believe that you have many experience in this area. You are the health economy researcher and also the program manager. And also you have a lot of research in the health technology assessment. Also the use quality research method in some area. Also make some systematic review and meta-analysis. I believe that you can share your knowledge and you can share your experience using the AI and also some research in the health technology assessment. Nowadays, you are the visiting faculty at the University of Hyderabad and also in the Australian National University. Until now, you are the visiting research fellow, but currently you already stay in India, right?
Yes,
Oh,
I'm in India.
okay.
Yeah.
So it means the time between India and Indonesia is not so
Short.
different.
Yeah, it's a bit short.
Okay. So Dr. Sani, the screen and time is yours.
Thank you.
You can
Thank you so
begin.
much, Dr. Farid. Let me just share my screen. Let me know when you can see it.
Okay, not yet.
I hope you can see the screen.
Okay. Yes, get it.
Okay. Good afternoon, everyone. Thank you so much,
Good
Dr.
afternoon.
Farid, Dr. Budiono, for the kind words and kind introduction. And thanks to Dion for the introductions and also coordinating everything as well. Dion and I go way back in ANU, Australian National University. So it's good to get the acquaintance of everyone back in Indonesia, and greetings from Hyderabad, India to Diponegoro University as well, and all the students, and welcome and good afternoon to everyone. So as alluded, I'll be speaking on use of artificial intelligence powered digital health technology in primary healthcare. So so this topic is going to cover artificial intelligence and its use in healthcare in general, but more focused towards primary healthcare and how we can use artificial intelligence in scaling technology, scaling health screening, scaling access, and removing disparities in healthcare delivery for communities around. So what we will also look into is few use cases specific to delivery of primary healthcare using AI, and how an integrated approach of healthcare service delivery is important in primary healthcare scenario. So without much, I'll just dive into what is AI. AI basically it generally applies to computational technologies that emulate mechanisms assisted by human intelligence, such as thought, deep learning, adaptation, engagement, and sensory understanding. So basically, what we are using AI for is through human intelligence, enhance our knowledge, enhance the computational technologies, and leverage on computational technologies to help us or assist us in various things. It can be a simple chat GPT, which you might be using for writing or learning certain things or automating certain tasks, or it can be related to image analysis, like your document reader. Simple scanning of document, the AI would analyze the document and tell you whether what could be the inference within the document, what is the content in the document, what do you need to do as on the basis of the content in the document. Or it can be related to healthcare, where you are using image analysis. You might be using textual data from clinical expressions made by clinicians, allied health professionals, to enhance healthcare or enhance patient outcomes. Artificial intelligence is out there in many, many, many aspects of our day-to-day life. And healthcare is one aspect of it. And we are all used to ChatGPT and large language models as well currently, right? So what is digital health? Digital health refers to the use of information and communications technologies in medicine and other health professionals to manage illnesses and health risks and to promote wellness. So overall idea of digital health is to promote wellness using communication and information technologies. So we are promoting the digitization of health care, and also to improve outcomes and also manage health risks in general. So how does digital health fit in health continuum? It fits in everywhere. It fits in at primary healthcare. It fits in at secondary, tertiary healthcare, advancement of drugs or drug discovery, and many more aspects. So what is primary healthcare? So primary healthcare, as defined by WHO, primary healthcare is a whole of society approach to health that aims at ensuring the highest possible level of health and well-being, and their equitable distribution for focusing on people's needs and as early as possible along the continuum for health promotion and disease prevention to treatment, rehabilitation and palliative care, and as close as feasible to people's everyday environment. So the last aspect of primary healthcare definition is very, very important. Whatever we do as part of healthcare service or delivery, it has to be at people's everyday environment, which means you're taking healthcare directly to the person's or individual's door side, right? Not that the person is coming to a hospital and availing healthcare at a hospital. Rather, you're taking the healthcare system or healthcare approaches to the patient right at their doorstep. That is the most important aspect of primary healthcare. So, this is what the WHO says. And what are the key aspects of digital health is something which we will look into. Digital health encompasses these different 8 broad areas. So, right from mobile health, where you have mobile applications to look at various aspects of healthcare. Like, for example, a patient application can enhance a patient journey. in a simple primary health center, or it can enhance, like someone said earlier, about women and children, child health, right? So for pregnant women, how do they navigate their pregnancy, right? So right from the start of their pregnancy to the delivery of the child, to immunization of the children, etc., right? If you have a simple mobile application which helps navigate the woman or the mother through the entire pregnancy journey, it becomes part of digital health, right? So it becomes an aspect of digital health. Similarly, how do you direct, the patient using uh, a health disease management point of view? For example, a patient has diabetes, right? So you can have a simple mobile application which can track their diabetes levels, their food levels, their dietary intake, etc., and then help them manage diabetes better. There are n number of applications which are available out there which are doing this already, right? So the mobile health encompasses that. And finally, simple health tracking, be it your Google Health or Apple application or anything, they help you track your healthcare. They track your footsteps, they track your I don't know, heart rate, your simple sleep patterns, etc., right, through wearable technologies. Telemedicine is another aspect of digital health where you are enhancing healthcare delivery through video consultations, remote healthcare delivery, and prescriptions through telemedicine. And telemedicine has gone a long way now because of, we are doing this conference, we are doing this seminar through teleconferencing itself, right? So the same thing can be leveraged to deliver telemedicine. A simple Google Meet or a simple video call on WhatsApp can deliver healthcare literally at the patient's doorstep. Electronic health records are an aspect of digital health wherein you are you're doing a structured digitization of patients' clinical data, where you're taking large amount of unstructured data and then organizing it into proper order. Dr. Farid knows more about this, as he has done a lot of research in this particular area, right? So similarly, EHR data can be used to analyze multiple aspects of clinical data, and then when it is stored safely, it means that EHR data are safe and secure for with regards to the patient's data. Similarly, you use analytics as part of digital health to give out descriptive, diagnostic, predictive, and prescriptive analytics. We'll talk about that further as part of AI as well. Wearable technologies like real-time health tracking, like tracking of your vital signs, be it your heart rate, sleep patterns, right? So all of these come as part of your wearable technology. If you're wearing a simple Fitbit or Apple Watch or Garmin, it will track your footsteps, and then it'll not only footsteps but also heart rate, sleep patterns, stress, SpO2 or oxygen saturation, and it'll give out analysis. It'll tell you how you need to take care of your health, etc. So this all comes into personalized healthcare. What other aspects are there as part of digital health and PHC or primary healthcare is health surveys. To be able to conduct rapid population surveys, simply take a simple tablet application or a mobile based application, go to the patient's doorstep, and then do a rapid population survey. In India, we have something called as integrated child development service, where this program implements a tablet-based application, which is being implemented by Government of India, where the health worker or community health worker goes to the homes of pregnant women and women with infants in their homes, and then take their vitals. They take their anthropometric data, document the data on the tablet, and it is analyzed. It is analyzed to see what are the patterns in their anthropometric data, what can we enhance further, etc. Not only this, the National Program for Control of Blindness and Vision Impairment, they have done rapid population surveys, rapid surveys for avoidable blindness, etc. So these surveys are being conducted as part of mobile or tablet-based applications, and they help in looking at large population scale prevalence parameters of a certain disease or health conditions. They also help you look at how care is being provided in the community. They help in doing health surveillance as well. During COVID-19 and COVID-19 pandemic and ensuing lockdowns, etc., the health department has conducted rapid surveys in certain locations where COVID was endemic, and then now it was not more. So you are doing certain sampling, etc., in the area to look at and do active disease surveillance as well. So that encompasses key aspects of digital health. How do we entwine digital health into primary healthcare? So primary healthcare, what does primary healthcare mean? As we discussed earlier, primary healthcare encompasses a comprehensive healthcare in nature, where you are uh, not only looking at preventive nature of it, you're looking at prevention, promotion, and treatment aspect of healthcare, where you can talk about prevention. In terms of prevention, a simple example would be immunization or vaccination for certain diseases in the community. Promotion could be promoting better hygiene in the community, right, to prevent infectious disease spread. Treatment could be related to providing access to treatment, sending them to or linking them to treatment hospitals, or simply it can be a counseling provided as part of mental health, right? So, or a mental health counseling as advocated by WHO. And also, long-term management of health is a key aspect of primary healthcare, where not only that you are doing an active screening of the community, but also you do it periodically, or you establish a primary health center in the community so that people who need care, they keep availing the care when needed and periodically. For example, breast and cervical cancers, you need mammogram, etc., for the women every 6 months, right? But what happens is most of the women are unable to access it. What if we provide an AI-based technology which would enhance that? People,
Dr. Sani, excuse me.
sorry, yeah,
Sorry.
yeah.
Your presentation is still not moving. Your PowerPoint,
Oh, is it not moving?
your PowerPoint not
Where is
moving.
it now? In which slide?
Now it's still key aspect of primary healthcare.
So
Still there?
I'm still on key aspect of primary.
Oh, okay. Okay.
Yeah, yeah, yeah.
Okay.
So,
Okay. You can continue.
it was key
Yeah.
aspects of digital health earlier.
Okay.
I moved
Yeah.
to key aspects of primary health. So, yeah. So as I was saying, with regards to breast and cervical cancer screening, what if AI-based technology is implemented in the community so that it would enhance, access to the screening programs so that women can avail, and it is cost effective, right? So such technologies have to be implemented as part of comprehensive care. Preventive health is a key aspect wherein you're using active screening, you're using health education and immunization in the community, which are key aspects of primary healthcare as well. Community care, you use local community health workers, local community members and leaders to deliver healthcare. And this encompasses, the involvement of the community in upkeep and better health outcomes in the community. Equitable access should be an integral part of primary healthcare, wherein you are looking at not discriminating people based on their socioeconomic status, religion, or geography. Rather, you're giving everyone an equal chance of availing healthcare. And how is it possible? It's possible through uh, establishing primary healthcare in various communities in regular geographic areas. And also, it can be enhanced through artificial intelligence as well. It has to be patient-centered, wherein you are doing a holistic approach to healthcare delivery, like for example, involving physical and mental health as well as social determinants of health to primary healthcare delivery. Continuity of care is also important, wherein you are ensuring that care is continuous in terms of active referral. It doesn't matter much when you are just doing a screening program in the community and going off. You have to screen, identify people, and refer the people to the respective treatment regimens and treatment programs, and also hospitals as well. What are the key benefits of artificial intelligence powered digital health in primary healthcare? Uh, Number one, it improves health outcomes because you are giving cost effective delivery of care, wherein uh, the you are improving or implementing digital health technologies which are more accessible, which are community empowered, which are also preventive in nature, and increased accessibility is the aspect of it. It reduces health inequalities and disparities. AI also helps in reducing burden on secondary and tertiary care. Because if you are identifying cases early in primary care itself, you're not referring them for treatments at secondary and tertiary care. Rather, you're reducing the number of people who go to hospitals for treatments. So that is the more important aspect of AI-powered digital health technology. Finally, it will also improve health-seeking behavior of community members within. So use of AI in healthcare and medicine will look at history and what are the beginnings of AI in healthcare. So initially, AI dates back to 1965, wherein at least in healthcare, of course, in other areas, it is being implemented far earlier also in mathematics, etc. But at least in healthcare, the first known project is Dendral project by Stanford University. This was used to or for hypothesis formation, specifically in chemistry and drug discovery. So Stanford University used this Dendral project. They used somewhere around 800 lines of code, and they used different decision trees and algorithms to look at hypothesis testing. Next came mycin in 1970. This is also a Stanford project wherein they've used artificial intelligence to identify bacteria causing infections. So what the AI had done is it had looked at what bacteria are causing different types of infections, and based on patients' anthropometric data like height, weight, etc., it used to adjust your antibiotic dosage and suggest patients in terms of what antibiotic and what dosage of antibiotic they need to take. Of course, it's gone into heavy criticism also because of all antimicrobial resistance, etc. Right? But we are talking about this in 1970s, right? So that's when they've implemented it. Next, in 1990s, etc., you had machine learning models in healthcare. In 2020s, you had big data and deep learning models in healthcare, like IBM Watson in oncology, and recent advancements in large language models and deep learning, etc., are leading or paving the way for drug discovery robotic surgery, telemedicine, and disease surveillance. So, like for example, if I were to throw light on drug discovery, AI implementation in drug discovery is very, very important because it accelerates drug discovery. If you look at pharmaceutical companies, the city where I come from manufactures a maximum number of vaccines in the world, right? So you can improve drug discovery through AI. It accelerates your development. It accelerates multiple aspects of drug development. So that's AI in it. Robotic surgery in terms of navigating the surgeons uh, towards proper identification of proper surgical areas and potential risks through image analysis is being highly regarded and highly used in robotic surgeries. Telemedicine, again, to give out uh, clinical decision support systems or or support the clinicians in proper decision making. Disease surveillance, especially as part of COVID-19 surveillance, you had disease spread and how the virus was spreading, etc., was monitored using disease surveillance and AI in it. Not only this, but also where large number of populations were gathering, uh, uh, governments and people have used it to see whether uh, proper personal hygiene was being followed, proper distancing or safe distancing is followed, etc. Right? So that's how AI was used. Masking was used. The a video camera can take the picture and then say if a person was not wearing mask, it used to say please wear mask. It used to identify a person who is not wearing mask and then tell them that they need to wear a mask. This was used in population areas like airports, shopping malls, etc. So that's how AI was used in image analysis and disease surveillance. Remote patient monitoring is also important. Delivering care at the patient's doorstep is important. So if you have a bedridden patient somewhere in the community, like Indonesia is large, it has large number of islands. So every island may not have access to healthcare, right? So if in a remote island community, in a community, few people need healthcare in their homes, you can't have a specialist going there and delivering the care. Rather, you can have continuous monitoring devices implemented in the community, implemented at the patient's bedside, and then the specialist can get AI data driven insights onto their mobile phones. And AI can give out risk of an adverse event happening so that at the right moment, care can be provided to the person in need. So rather than continuously being present on the bedside, specialist can focus on treating large number of people, and at the right moment, AI can indicate that there is a chance of adverse event happening and the care can be delivered at the patient's bedside itself. So what these are the early beginnings, but what are the recent advancements in terms of research related to AI in healthcare? So there are lot number of research articles which are published on the use of AI in healthcare. This is a word chart wherein the word cloud shows what are the keywords being used as part of research on AI in healthcare. So this one says healthcare, big data, decision support system, deep learning are the most widely used aspects of AI in healthcare research. Telemedicine also comes into it, medical informatics, descriptive analytics, clinical decision support system, etc. So all of these are the most commonly used words in AI in healthcare. What are the countries in terms of the countries doing AI related research? The top countries are USA, of course, which I think publishes more number of articles than the next 3 or 4 countries combined. and then followed by China, UK, and India. So many countries are following the suit. There is an increased interest of towards AI use in healthcare in various countries. Certain countries are also yet to start, like Russia and some of the African countries need to focus. But you can see Europe, US, and Asia lead the way, and Australia lead the way in terms of AI research in healthcare. What does AI encompass? These are the various aspects of which AI encompasses. You have data from electronic health records, which can be used to in AI development towards various aspects, which I'll be speaking further. Medical imaging data, wearable devices like your Apple Watch, continuous glucose monitor, like your Fitbit or any other tracking, or a simple VR headset. Nowadays, you have VR or virtual reality headsets, or augmented reality or AR headsets, which are helping you see and analyze visual data as well. Not only that, there are augmented reality headsets wherein you put it on the head, it will map your mental health as part of it. Genomic data to enhance drug discovery, vaccination. It encompasses multiple things, treatment, and also to give into personalized medicine as well. Sensor data from various sensors which are used in healthcare, right from uh, primary health center to a full-blown hospital, can use sensor data, and the AI can use this data to predict outcomes. Environmental data, like how you have agent, host, and environment, right? So how these three interact is something which AI can analyze and give out. And behavioral data, how patients or clinicians or service providers, all the stakeholders within healthcare use the application, simply a mobile application, the behavior side of it, whether they use certain feature in the application, whether they are availing proper healthcare service delivery. All of the data comes in, and then AI can be used to enhance and analyze and enhance that data as well. So this is what it is. And also not only environmental data, but also other data like, financial data, economic data of populations can be used to look into socio-economic side of primary healthcare. So what are the key AI technologies in primary healthcare? Right from machine learning and predictive analytics, which help in designing applications for disease prediction and personalized care. AI-powered diagnostics, wherein you're using imaging data and symptom checkers. Like, for example, a fundus photo or retina photo can predict your diabetes, right? Or diabetic retinopathy. Natural language processing or NLP to enhance EHR and patient consultations. So, for example, if you have a hospital with, let's say, 1 million patient records, but the hospital has been there for 20 years and it has all the data in physical format, which means pen and paper, right? Now, if you need to analyze all of the data, you can't do that by just typing all the data, digitizing it. Rather, you can use natural language processing to look into these old patient records and then process them, structure them into digitized data, and then AI can analyze the data to enhance your patient outcomes. Similarly, mobile AI solution, as we spoke earlier, can help like in terms of delivering care in remote areas, community outreach, and telehealth. What does AI involve in disease prevention and early detection? Early detection of chronic conditions is vital, like diabetes, mental health, and vision care. So you have diabetes where simple fundus photo or retina photo, can look into diabetic retinopathy, can look into glaucoma, it can look into age-related macular degeneration. Not only that, but subtle changes in the blood vessels in the retina can also indicate chronic kidney disease as well, right? So you're not only looking at one particular organ, but also multiple others, right? So you're looking at one image and then AI is detecting multiple other things. Similarly, predictive risk modeling can be done using AI, wherein you are managing chronic diseases. While managing chronic diseases, you are improving population health outcomes. Wherein in terms of chronic diseases, like it can encompass personalized medicine, a simple mobile app with AI and continuous glucose monitor data can give lot of predictive analytics, right? So it can give out what could be your blood glucose levels depending on your dietary fashions and what you need to do next, what kind of physical activity you need, etc. So those kind of predictive analytics are possible, and people are already doing that in healthcare. AI in vaccination and immunization programs, wherein you can use AI for enhancing public health service delivery through efficient distribution, managing your logistics better, managing your cold chain better through AI. What areas need, depending on your weather conditions, what kind of cold chain you need or you require in your logistics, etc. It can also look into, as Dr. Farid's research says, look into your EHR data and look at how human resources are used efficiently in the hospital, how patients are efficiently directed within the hospital. So AI can enhance that. You do not need a human to do those tasks. So simply put up, where AI can be applicable in healthcare is AI can do lot of repetitive tasks simply, so that we as humans can focus on larger picture, larger problems at hand, wherein we are using our resources for uh, critical thinking and critical analysis rather than doing repetitive tasks. That's where AI would enhance our uh, enhance in healthcare as well. So improving healthcare access and efficiency with AI, wherein you're doing remote diagnosis and telemedicine, personalized health interventions like data-driven insights, and community health worker like enhancing capacity through AI-powered health assistance. So for example, if you are a health worker and you are of course trained in mental health counseling, but you have some questions, you have some apprehensions within while delivering the care in the community, you can have a customized AI powered GPT, wherein it can suggest you what you need to do. It can suggest you in terms of what extra educational tools which are available, extra video and audio tutorials which might be available for you within the within or at your disposal, so that you can go through those tools properly and then talk about it further in your uh, care delivery itself. How does AI impact? Does AI have any cost impact or economic impact? Yes, implementing AI technologies could be cost effective. I'm saying could be because sometimes AI can be costly as well, right? So it is very important to make AI technologies which are cost effective. Otherwise, it makes no sense. If you're replacing some clinician or some allied health professional with AI, then it has to be cost effective, right? So it has to make sense of it. Rather than replacement, we are talking AI not as artificial intelligence, but as augmented intelligence for healthcare professionals, right? Wherein you're not saying you're replacing a healthcare professional with AI, Rather, you are saying you are augmenting a healthcare professional with AI, right? So you're enhancing their work efficiency. You're helping them in terms of making better decisions. So AI technologies have to reduce healthcare costs. Otherwise, they will be eliminated. They will not be effective in nature as well. They should be accessible and they should eliminate disparities in giving out healthcare. They should also help in optimizing resource allocation, be it in staffing, inventory, service delivery, right? So tomorrow, if I need to plan a vaccination program in a population, or a community, if I have data at hand, I don't have to go and analyze the data myself. Rather, the AI can enhance the data, analyze the data, and then say what number of vaccines are required, what is the inventory which I need to keep, and then I'm better prepared in going and delivering it in the community. Similarly, enhancing healthcare worker productivity, because decision making helps in productivity. It enhances that you are covering more people through AI rather than covering less number of people manually. You are using AI to cover more number of people. And this will lead to less burden on the healthcare professional. Similarly, AI, everything about AI is not good. There are certain challenges or concerns as well, which have to be taken very seriously. Ethical concerns are important. Bias in AI algorithms is a big thing. Like if I use technology and, for example, if I have used AI technology or developed AI technology for screening for diabetic retinopathy, and if I've used it on Indian population would have a different way. The AI would behave it in a different way in Indian population compared to, let's say, I'll take the same AI algorithm to Indonesia. It would behave it in a different way. It may not be so, it may not have the same sensitivity and same specificity and accuracy in Indonesian population as it did in Indian population. So there is always bias in AI. Not only that, specifically certain algorithms like ChatGPT, etc., or large language models have shown to have bias. They are racist as well because they are developed from us humans, right? So we have certain biases and we are pushing those biases onto AI as well. So it is very important to understand these biases and eliminate these biases in AI algorithms as well. Similarly, patient privacy is extremely important, wherein AI cannot look into patients' personal identifiers and then target them indiscriminately. So that is very, very important. Patient privacy and data security. AI cannot breach data security and then use the data or push the data into a different database, etc. So data security becomes extremely vital. And these are genuine concerns. These are serious concerns which are laid out on AI, and they are still, believe me, unaddressed. There are a lot of AI algorithms where you do not have a professional body in certain countries to look into the implementation of AI in healthcare, right? So there are laws not written to govern AI in healthcare. So these are very, very important for policymakers to push for change in our establishment of a monitoring body. Similarly, there is digital divide in terms of access to AI-driven care. Not all people will be able to use, AI-driven healthcare. Simply, for example, ChatGPT. Not everyone is able to use ChatGPT efficiently. Uh, Not only ChatGPT, but also various other. You ask people to take photo of their face and then ask AI to analyze it. People take different types of photos. That becomes a challenge. There is a digital divide in the population. Youth nowadays are digitally native, which means they are able to use digital tools efficiently. But what about people who are aged above 50 years? They do not know how to use, or large number of people do not know how to use mobile applications. Forget about artificial intelligence. Regulatory and quality control issues are there, wherein there is a large requirement for regulatory framework in the way companies design artificial intelligence algorithms for various medical devices, various healthcare interventions and initiatives. So quality control issues are also important, wherein yeah, you can identify a most common disease condition through AI, but what about the rare conditions? Uh, Companies do not invest that amount of money in detecting rare conditions and in making AI-based programs for detection of rare conditions. So you need to ensure that those are also there, and also quality is also there. You can't have AI which says I have sensitivity of 75% and specificity of, let's say, 85%. It will not work. It means it leaves out 25 more people out of every 100. So it does not work in a population scenario. At the same time, you can't have a screening tool which has 99% sensitivity. That may also not be necessary. Rather, you need to have a subtle place where you say, okay, this much of sensitivity is enough, like 90% of sensitivity or specificity. Similarly, algorithmic decision making, there are ethical implications in terms of AI driven diagnosis. Tomorrow, let's say AI says you're using AI for mental health detection, right? Condition detection. Tomorrow you screen a person, and if the tool has 90% specificity, that means out of 100, for 10 people, it might say you have depression, right? Which is not good. It has to correctly diagnose and also correctly say people who do not have the condition as they don't have. But if 10 people do not have the condition, but tomorrow AI says that you have depression, the implications can be very bad. Implications can be you know very, very, very bad for that particular individual. So what are the ethical implications of AI is something which is very important. So decision making, are you involving only AI? Or as I mentioned, it can be augmented intelligence wherein you are substituting AI or substituting individual and then combining both to make the decision making, rather not leave it to only AI to make the decision. Digital literacy is also important, and AI has challenges in this area as well. So, and AI, wherein you need to make sure that people trust AI in the first place, or use of AI-based technologies. A lot of healthcare professionals themselves have apprehensions about AI technologies. So one way to make sure that every stakeholder can use AI is to say that AI is not artificial intelligence, but it is augmenting you, right? So it's not replacing. That's one of the ways you can make people trust use of AI. It is not there to replace, but to enhance our knowledge. And also patients, how patients understand AI technologies is important. Trust comes only when you have safeguards in place, wherein you are saying that, okay, this AI has good clinical. So stringent regulation is important. You can't allow an AI technology which has very low accuracy to be out there, to be being implemented for a health program. You need to have those regulatory frameworks and quality control in place. Otherwise, professionals and patients will not trust AI technology. So these are the various benefits, various aspects of the use of AI in healthcare, and the challenges of using AI in healthcare. All of these challenges can be addressed, are being addressed as well. Like, for example, ethical concerns, you have efficient institutional ethics committees, IRBs, or institutional review boards reviewing the AI applications. You should not only emphasize on clinical trials of AI, but also emphasize on real world evidence. So real world data and real world evidence are important in terms of removing these ethical concerns and digital divide and most of the aspects which I have discussed. Professional regulatory bodies within communities, within countries is important. Like you have data privacy and protection acts, you have GDPR in Europe, right? So all of these regulatory bodies will ensure that patient privacy and data security are protected. Similarly, enhance applications which focus on UI UX or user interface and user experience, and applications which are easy to navigate for patients and healthcare providers will ensure that you have better digital literacy and better access to programs, not only AI, but in general digital health technologies. So what does professional body do for AI in healthcare? So WHO has initiated something called as Global Initiative on AI for Healthcare. This body basically ensures that ethics and governances are in place for AI technology. They have large number of tools. Like all of these, it gives you, there are tools related to regulatory considerations on AI for health. Similarly, how evidence generation is important in or while making software for medical devices or AI software for medical devices. And also a global strategy document on digital health, which also has AI aspect in it. So these are the various tools which are available from World Health Organization. There are professional bodies also which are being implemented. Like in India, in my city of Hyderabad, there is going to be an AI institute which is being established by central government, which will look at accelerating the AI use in healthcare in itself. So that's a good way forward. Similarly, lot more other countries also have similar arrangements, similar bodies being established. So these are very good initiatives from the professional bodies. So just excuse me for a minute.
Yes.
So if you have any questions, I'll be free to take in between also. So if the audience has any questions also, I'll be happy to answer.
Okay. Anyone you can ask some question to Dr. Sunny in the middle of the speech. It is okay, and Dr. Sunny will answer you. No one? Okay, maybe dia. I will speak in bahasa, okay? So
Sure.
okay. Adik-adik mahasiswa, Anda bisa memberikan pertanyaan langsung kepada Dr. Sani, atau Anda bisa memberikan pertanyaan melalui meeting chat. So everyone here, you can ask the question to Dr. Sani by using the meeting chat, or you can directly raise hand and then Dr. Sani will take the question. Okay, Dr. Sani, you can continue. No one here.
Okay.
Okay.
They can also type in the chat bot as
Yeah,
well.
yeah.
Yeah, chat section, not chat bot. Okay.
At the chat windows. Oke, silakan adik-adik bisa bertanya melalui Windows Chat. Anda silakan bertanya dalam bahasa Indonesia, is okay. Saya bisa menerjemahkan. You can, if you have the question in bahasa Indonesia, is okay. I will translate for you. Don't be shy. Some students is shy.
So once I used Google Translate when I was in
you can-
Jakarta,
yeah,
but
yeah.
it did a terrible job at translating. So yeah, that's how I remember. Okay, shall we proceed?
Okay. Yes,
Okay.
you can proceed.
So what does AI help solve when we look at disease burden? This is the disease burden data. In terms of DALIs, total disease burden, you have CVDs or cardiovascular diseases and cancers having the largest disease burden, followed by other non-communicable diseases and mental health disorders. So these are, it contains communicable and non-communicable diseases. If you look at it, this is the largest burden is with CVDs and cancers, and followed by mental health conditions. So where are AI powered technologies in terms of addressing these various disease conditions? So we have AI enabled technologies in cardiovascular diseases. I'm talking about looking at it in terms of digital health and primary healthcare. Of course, there are AI technologies in tertiary care where you have, like I mentioned, robotic surgery, etc. But we will stick to primary healthcare. So in primary healthcare, we have CVDs, we have cancers. For CVDs, you have monitoring of cardiovascular health through, let's say, ECG and AI analytics on ECG data. You have digital stethoscope and AI analytics on digital stethoscope. For cancers, you have cancer detection like breast, oral, and cervical cancers, where you can use image analysis to detect the cancers early at an early stage so that you're preventing long-term bad complications or potential adverse outcomes. Similarly, for mental health, you have AI-based detection of mental health conditions, AI-based interventions, and AI-based referral and management of cases with mental health conditions. Similarly, for diabetes, you have CGM data, continuous glucose monitoring data, and this also goes into ophthalmology, wherein diabetic retinopathy can be detected. It can go into neurology, wherein you are detecting diabetic neuropathy early. Similarly, you have transport related injuries, which can be again enhanced through AI technology. You have hearing impairment and detection of hearing through AI powered technologies as well. So this is the disease burden in the world. I'll take you to India and then show you how healthcare is delivered in India as well. So, India, just like Indonesia, we are a developing country with a lot of potential, lot of GDP and high growth rate. If we look at Indonesia and India in terms of economics, both are similar in nature. Uh, in terms of country's economy, GDP per capita is higher in Indonesia, I guess. But in terms of challenges are different in both the countries. Indonesia access becomes a bigger challenge, wherein in India, uh, cheaper technologies are important to penetrate and make them accessible. Similarly, if we look at in India, we are also dealing with population, a large number of population. It is the most populous country in the world. We also have a socioeconomic divide, a large socioeconomic divide, wherein uh, everybody will not be able to pay for their own healthcare. So if you look at India's health system is a mixed health system, which means it is a combination of public and private healthcare. In terms of GDP per capita spent on healthcare, or overall proportion of GDP which is spent on healthcare, we spend close to about 3% of our GDP on healthcare. 3% includes both public and private spending and out-of-pocket spending. Government spends about 1.3% of the GDP on healthcare. 1.7% comes in from private enterprises, NGOs, and individuals out of pocket expenditure as well. If you look at OECD countries and all the associate OECD countries, and if you look at developing countries, typically developing countries spend about 50% or 45 to 50% out of pocket for healthcare. Wherein in India, we spend about 67% out of pocket on healthcare. So which is a huge number, huge amount which is being spent on healthcare out of pocket, which means many people are not covered through insurance. So insurance becomes a vital part in healthcare service delivery. And specifically, the reason I'm saying economic side of it is, one, because I'm a health economist. Two is because AI, in order for AI to be successful, economics play a vital role. Not only AI, but also any health technology, any technology for that matter. Right. So, like anywhere in the world, healthcare in India is basically a three-level healthcare: primary, secondary, and tertiary healthcare. So at primary level, like the base of the pyramid, where you're covering large number of population in primary healthcare, wherein you have community-based screening, primary health centers, etc. You have where you can implement AI as part of tablet-based applications or tablet-based screening applications. You cannot have AI deployed in the cloud and then ask the mobile to connect to the cloud and then analyze data and then give a diagnosis. Rather, nowadays, computing power on a mobile has become so better that even AI can be implemented on a mobile device. It can be implemented offline on the mobile itself, on the mobile or tablet itself, so that you can run the image analysis on the mobile and AI can give you the diagnosis. You don't need high computing wherein you're sending the data to a server and the server has AI built in it and it analyzes, and then again you connect to the server through internet and then you get the diagnosis. You don't have that much time. So any technology which is going out to cater for primary healthcare needs to have an offline capability wherein artificial intelligence algorithms are deployed in the device itself. And that is important. And similarly, a referral and live data synchronization from primary health centers becomes important, wherein you're doing modality integration. Suppose a primary health center is using microscope. That microscope needs to be integrated with the computer so that data are transferred properly. You are following FIRE codes, HL7 codes. These are various standards which are established for data transfer and in a secure way, right? So you're using the right protocols to transfer the data from different devices into the computer and thereby analyzing them. Similarly, AI can play a role over here as well in terms of using different devices or modalities to diagnose. Secondary healthcare, you have EHR systems being deployed in secondary healthcare. You have financial or economic data from the hospitals, and you have inpatient, wherein AI can help you in triaging the patient. When the patient enters the hospital, based on the symptoms and signs of the patient, you can triage the patient to various departments, right? So if it is an emergency, where do you need to send the patient? Or if it is a simple symptom, where do you need to send the patient? You do not need these are automated tasks, right? These can be automated, and AI can be used to automate these triaging tasks. Tertiary healthcare, wherein you need enhanced clinical decision support, enhanced clinical reporting, wherein AI is used towards better planning the patient care plan, similarly, better delivery of drugs, etc. And moving on to centers of excellence, which are also part of tertiary healthcare. Centers of excellence have advanced data. They need, with advanced data, they need advanced analytics. There are millions of case records in centers of excellence where you can use those data points to analyze and then give out, like I mentioned, diagnostic, predictive, and prescriptive analytics for it. And use this real world data for clinical research. AI is playing a big role in clinical research as well. And usage of real world data for clinical research is important. And then throughout this care continuum, right from level 1, which is primary care, to tertiary care, we are using big data analytics to give out healthcare analytics and decision making at various levels as well. So in India, what are the prevalence and what are the conditions which we are looking at? Like I mentioned, in the global burden of disease, we also have a higher burden of mental health conditions. So we talk in millions only because we are a population of 1.4 billion people. So our burden of disease is also very high. So I have laid out only few conditions over here, but there are multiple other conditions which need to be approached using AI. So just by looking at mental health, you have close to 200 million people with mental health conditions. Do you think developing mental health professionals and training community health workers with in terms of delivering uh, counseling sessions for people with mental health disorders will be enough? It will not be, because that means you need to train huge amount of workforce, which is not practical. So you need some technological intervention which is used to cater for these numbers, these big numbers, right? We also have in ophthalmology, we have close to 5 million people who are blind and about 70 million people who are visually impaired. We also have about 40% who are who would be developing myopia or vision impairment in the next few years. So which is very staggering, which is a huge number in terms of service delivery. Similarly, hearing impairment is also high, uh, close to 230 million people with hearing impairment and non-communicable diseases. We have the highest burden of non-communicable diseases in the world. We also have one of the highest number of blind people in the world. So we have, in terms of scale, we have a huge burden of disease. How do we address? It has to be a multi-pronged approach, wherein you're not only training health professionals, but also using AI to screen these individuals early. But what are the challenges of digital specialty solutions? When you are trying to digitize anything, you have, if you ask a clinician to document everything, the first point for artificial intelligence to work is to get the data, right? Data is important. Getting structured data is even more important. First of all, in order to get the data, you need to document the data. You need to update the data in an application. But who does that documentation? If you are asking a clinician to do that, they feel burned out. because of various reasons. It can be because the application is not user friendly. The application may not work for their particular specialty, or is maybe just because they have too much of patient load. If they have too much patient load, they feel burned out, they will not be able to update the data. Similarly, applications are not built to to modern needs. So they are not relevant to modern needs. They are like, you have designed some application using some code which is ancient, but it is not solving the modern needs. Suppose a clinician gets a new type of device for a particular diagnosis. The application needs to be able to integrate with that particular device, and data from that device needs to flow seamlessly into the application, which is what is important nowadays. Implementation issues are there wherein you are unable to scale, unable to implement, unable to train healthcare professionals to use your AI-based technologies. Clinical workflows are important, wherein every organization or every specialty has its own way of functioning. Sometimes, if you look at a simple ophthalmology as an example, patient comes and goes into registration. After registration, there is somebody an allied health professional doing the basic workup of the patient. But it may not be true in every country, every scenario. Sometimes they might go directly to a physician, directly to a specialist or an ophthalmologist for the intervention, right? So a workflow needs to be flexible. It has to be configurable, so that it can be adapted to any kind of hospital or organizational workflow or organizational need. Applications are built in silos. Like previously, I mentioned mental health. An application designed for mental health will not work in ophthalmology. An application designed in ophthalmology will not work in obstetrics, right? So you need to have, or an application which is a laboratory information system, right, will not integrate with the HIS, hospital information system. It will not integrate with EHR or electronic health record application. So every application is built in silo. So applications need to be integrated with each other. They need to talk to each other through APIs, etc. So that interfacing is very, very important in uh, addressing the challenges which are faced in digital specialties, right? So what are the numbers we are looking at? If you look at India, this is the disease burden, like 10% has mental health conditions, 5.5 crore or close to about 50 million people are with cardiovascular diseases, etc. We also have only 69,000 hospitals in India, right? Which is very, very little compared to a developed country. Our MRI penetration is very low. Our access is also very low to certain things, right? So we are trying to solve all of these as part of our organization as well. So when we are looking at addressing these conditions, we have programs in this way. Like for example, be it India or Indonesia or anywhere in the world, screening program, they go do the eye screening program, come back. And audiologist goes there, does audiology screening separately in a different community, comes back. Similarly, for women's health, there are programs which are being implemented in silos. So if you look at it, each of these is like a jigsaw puzzle, right? So each of it is a simple separate jigsaw. What we need and what World Health Organization also addresses is to have an integrated approach where you have integrated people-centered health services being implemented. So what needs to be done is to combine all of these puzzles and make it an integrated AI-powered screening solution so that you have AI power to screen for everything together. Of course, this is not true for all the use cases. Suppose you are doing a diabetes screening program, you might want to only go with eye health, point of care devices, and a bit of cardiovascular screening as well. If you're doing mental health, probably you need most of these because it should be an integrated approach. If you're doing a community screening for the elderly, you might want to have audiology, eye health, mental health, and preventive care in it. So all of these need to be plug and play, wherein you can implement 3 or 4 programs together so that you're addressing it in a holistic way. So you have horizontal integration between various specialties out there. So in the subsequent slides, what I'm going to do is I'm going to highlight various technologies which are out there, which we are implementing as part of my organization as well, and how these technologies are being implemented, what AI is there as the backend of these technologies, and how these are implemented in specific use cases as well. I'll talk about a use case of mental health and how we can enhance mental health service delivery, mental health screening using artificial intelligence. So we'll start with point of care. For point of care, you have in vitro diagnostics, etc., so that you are screening for infectious diseases and also blood work. And AI can be used to analyze this data to predict health outcomes for the population. If you are doing a population screening, you are getting the patient ready before the patient reaches the hospital for treatment itself. So at a primary care level, point of care devices are important. Many number of people are using point of care devices. Many organizations are using them as part of their primary healthcare delivery. So simple needle prick can give you certain data points, but do we need needle prick to do all of these diagnostic tests? Now AI has enhanced so much and is developed so much that you may not necessarily need a needle prick or an invasive way of testing for various conditions, right? So like, for example, this technology, this uses a simple face scan to detect for various vital signs of the person. Like a face scan for 30 to 60 seconds can give you details such as heart rate, stress levels, your blood pressure, your blood glucose levels as well. So it uses something called as uh, photoplethysmography, or what it does is it uses your phone camera, and then through your phone camera it looks at subtle changes in your blood vessels on your face, and it will detect for heart rate and other vital signs. So this is very promising technology. It is non-invasive, it is non-contact and non-invasive. So it has immense applications. Like if you have a pandemic kind of situation again, uh, post-pandemic, people are hesitant in doing, contact methods, right? So rather, you can deploy this technology so that, non-invasively and non-contactly or contactlessly, you are detecting for various vital signs. It's called remote photoplethysmography technologies, or RPPG, which is used to detect for various things. And AI uses it. It's the back end is artificial intelligence. Similarly, for oral health, you are using multispectral camera. A simple camera, which is of the size of a toothbrush, can be used to scan your oral cavity, And this camera throws out light in various wavelengths into the oral cavity. And then the reflected light, which has various wavelengths, is captured by the multispectral camera. And then the camera analyzes, the AI analyzes the picture and uses various wavelengths of light to build a digital photocopy of the oral cavity, and it gives out whether the patient has inflammation or early signs of lesions which can lead to an oral cancer. So you're detecting oral cancer much before it happens. And the analytics can also be used to say what could be the outcomes. Do you have a higher risk of developing oral cancer based on your demographic, based on your environmental exposure, based on your profession, based on your eating habits, etc. So the AI not only uses imaging to analyze for hello. Somebody wants to speak.
No. You may
Okay.
continue.
Okay.
Because it is look like a stop like that. Okay.
So that's how you're using the camera to not only camera, but also the demographic and environmental exposure data to detect for potential adverse effects, potential uh, oral cancers, etc. So that's how you're using the technology. Similarly, for eye health, uh, you can integrate with multiple image. Eye health is basically nothing but imaging, right? So you are using imaging to a larger extent in eye health. Uh, you are using multiple devices to screen for multiple areas of eye, like images for cornea, images to take retina photos, images to analyze your crystalline lens inside the eye, and also visual fields, etc. So this technology basically uses fundus photos or retina photos to detect for glaucoma, age-related macular degeneration, and also diabetic retinopathy. So when you detect for these conditions, you are also detecting for screening for like chronic kidney disease, etc. Eye is the only area where you can look into the blood vessels without cutting the tissue, right? So anywhere else you have to cut the tissue to look at blood vessels. So it becomes a vital part in any kind of screening. And latest technologies are also looking at how it can lead to diabetic nephropathy, right? And how it can help in detecting early signs of ischemic heart disease. So these are the upcoming and newer technological and advancements in using ocular imagery to detect systemic diseases. Similarly, a simple phone photo can detect for ocular surface injuries, ocular surface conditions like inflammation, conjunctivitis, etc. So these are the things. So for mental health, uh, uh, people are using vocal biomarkers to detect for mental health disorders. So simple, subtle changes in your voice can be picked up by artificial intelligence, and it can analyze your vocal biomarkers to detect for depression and various levels of depression and anxiety. So that's AI in it. What it does is it uses acoustics, voice acoustics to detect for these conditions, which means it is language independent. So if you are speaking in Bahasa and if I am speaking in Hindi or English, it doesn't matter. You can just deploy, you can speak to the microphone for about 1 minute to 5 minutes, just as a normal conversation. Or while I am speaking, I'm presenting this presentation, we can use the application and it analyzes my voice and says whether I suffer with depression or not. Mental health analysis of mental health conditions or detection of mental health conditions so far has been only subjective, which means when a person feels that they are depressed or they need some intervention, they go to a psychiatrist or a psychologist who uses some questionnaires like PHQ-9 or disability questionnaire, etc., to detect for whether the patient, and also counseling to detect whether, or say whether the patient is suffering with depression or anxiety, etc. So it has always been subjective. Now the technology is at your disposal. AI is developed so much that you can use AI to detect for mental health conditions using voice as your biomarker. Similarly, other researches are also happening in terms of detecting depression, anxiety using your blood biomarkers. There are changes in your blood parameters so that which indicate that you might suffer with certain mental health condition. And then what do you do in mental health? You can also use AI for AI-based therapy. This is also a promising forte where you're using AI-based chatbots to interact with a person who needs intervention, right? So AI-based therapy platforms are being developed by multiple people out there. So wherein you're using large language models like GPTs, etc. But it also needs to be, there also needs to be caution, because when you're developing and if the chatbot suggests something wrong, the potential consequences are very adverse. So it is very important that we put safeguards in place while developing these technologies. So you have objective way of detecting mental health, which is voice-based blood biomarkers. And you also have AI where you can deploy AI for therapy, for intervention. So right from screening to intervention, you have AI, especially in mental health. Similarly, we have for women health, there are technologies like these, which are again non-contact, non-invasive, not non-contact. They're of course contact, but non-invasive. So this one basically is like a cup which is placed on breast of a woman at various zones on the breast of a woman, and it uses thermography as imaging. It has no radiation like a mammogram. So it uses contact thermography to build thermal imaging of your breast tissue, and it can detect your breast cancer. The technology needs more improvement, but a lot of professional bodies are advocating for this because mammogram is very expensive, and guidelines suggest that women need to have a mammogram done every 6 months to 1 year. And especially in Southeast Asian populations, women health is very, very important. Indonesia is investing a lot of money towards women health. Like your dean and others have advocated, there is a lot of things which are happening. So similarly, when you are catering to women health, you need to have cost-effective tools, and you can use AI technology to leverage on it to deliver accessible care. So this particular tool has good amount of sensitivity and specificity. Of course, there are certain limitations also in terms of breast tissue and the density, etc., where the sensitivity drops a bit. But the crux of it, of any primary healthcare screening device, is that you are screening a lot of people, you are detecting more people, more number of people, which becomes more important. Similarly, for cervical cancer, there is image-based colposcopy, which is again advocated by professional bodies. Even WHO says for advocates for cervical cancer screening using AI-based colposcopic devices. So these devices are these devices have high sensitivity, specificity. You have sensitivity of 93% and specificity of 89%, which means they are okay for screening, not okay for diagnostic criteria. So the whole idea of using AI-based technologies is that you are screening people early and then you are sending them to a specialist for further diagnostic testing, right? So that is what is important in case of AI-based screening in a primary healthcare setup. Similarly, for cardiorespiratory health, people are implementing digital stethoscopes, which means this is not traditional ear-based stethoscope, rather than it is a digital one, wherein it is connected with a mobile phone. You can use a Bluetooth headset and listen to heart and your lung audio. Similarly, you have ECGs, which are again digitized, and AI is analyzing these two data points. And then it can predict, it can suggest, and it can give you out analytics from the data which gets generated from these devices. So it'll give you out multiple inferences using the data from these devices. So this is again textual data. Whereas earlier we have seen that this is image data. For mental health, it is voice data. And for eye health and oral health, it is image data. So you have AI which is implemented in different types of data sets as well. Imaging, voice, text, and numbers. Right? So similarly, you can combine digital steth and ECG with a portable X-ray machine so that you're screening for entire chest cavity, which includes your heart and lungs, and then detect various conditions, right? So with a higher accuracy. So you are detecting for through a chest X-ray, you're detecting for lung conditions, infections, and other things like cancer, etc. So you can capture these, use this image and text data to run through AI and get results from artificial intelligence algorithms. Similarly, continuous monitoring is important. Continuous monitoring can be deployed using the devices which I mentioned earlier. The devices such as X-ray, such as ECG, such as digital stethoscope, and simple mobile photography can be used on bedside of the patient in their homes. And when you implement these technologies in patients' homes, uh, early warning signs can be sent out remotely to the specialist or physician in a different location so that you are monitoring the patient rather than having an allied health professional on the bedside of the patient. You can have AI monitor for vital signs, and have AI to predict adverse outcomes so that the allied health professional can invest their time efficiently in screening programs or in much more better functioning of hospitals and clinics. So that's how you're using AI to enhance patient care. Use it for contactless technologies, for early warning signs, etc. Similarly, we have seen ocular imagery for diabetic retinopathy. For this one, this is a simple portable device which uses vibrations at various zones on the patient's foot, which can detect for signs of sensation loss. So loss of sensation can lead to ulcer. Ulcer can lead to gangrene, and gangrene's treatment is only amputation. So these are the consequences of diabetes. So you can use AI-based device. This device uses vibrations, and the AI analyzes these data and then says whether the patient has any sensation loss, any other complication in the foot as part of diabetes, and then give out the diagnosis to the patient so that you are preventing foot ulcers, you are preventing foot amputations as a potential adverse outcome of diabetes. X-ray and imaging are important, wherein these portable X-rays can be, with the AI, can be implemented in various scenarios. Like you have neonatal ICUs. You can't take the baby to a high radiation X-ray room, right? Which is not recommended for for an infant or a newborn. Rather, if the newborn is in a neonatal ICU, you can take a portable X-ray and take the image of the baby, and the AI will analyze the imagery and give out the diagnosis. Like, for example, a simple pneumonia can be detected through the AI imagery. Portable X-rays are known to have low radiation, which makes it very beneficial when you are specifically screening neonates or newborn babies. And so you in Indonesia and India, we have primary health centers wherein you are catering for uh, women and children, right? So wherein you are catering for pregnant women and children. So this X-ray, portable X-ray becomes important there. Similarly, you can have them deployed at old age homes or elderly care units where falls are important, right? So patients are prone to falls, or elderly people are prone to falls. A portable X-ray with AI can simply take a photo. The AI can say whether there is a fracture, what kind of fracture, etc., and then remotely send that data to a clinician or orthopedician sitting remotely in a different location, so that orthopedician and the clinical team are prepared well in advance before the patient comes to the hospital. So that's the whole idea of deploying these technologies in primary healthcare scenario. Similarly, these images can be used for tuberculosis screening as well. So the images are analyzed using different data sets, and they enhance, in terms of image pre-processing enhancement. And also, it is important that they are being implemented in multiple underserved areas, right? So right from people who are underprivileged to inaccessible areas, to vulnerable populations like women and children. And also it is important that the AI algorithms are trained using diverse and multiple data sets. A PACS solution with AI diagnostic platform can also use image data, be it ocular surface image or MRI data or CT data or X-ray data. All can be run through AI algorithm, and the AI can give out predictions. Right here as shown, the chest X-ray can be analyzed, an MRI can be analyzed of any tissue or any organ in the body, and then the AI can give you algorithm. All of these are fine. What else can AI be used for? AI can be used in clinical decision support system. As I mentioned, AI should be looked at as augmented intelligence for clinicians and allied health professionals. For patients, of course, it is AI. For patients, it can be looked at uh, as something which can help in their patient journey within navigating a health system, a health scenario. For health economists like me, the AI can help in enhancing or looking at long-term outcomes, long-term outcome prediction, and long-term effects of a particular disease condition, and also various interventions. They can also support clinicians in terms of disease insights, prognosis, and outcomes. They help in data-driven decisions. So clinicians are better equipped in terms of availability of data and the right suggestion. So they are not saying that, okay, clinician, you for this particular data, the patient might be having X condition. Rather, AI can say what could be the differential diagnosis for a particular condition. And based on the differential diagnosis, it can also predict and say what are the chances of a certain condition X happening. So that's how AI can be used for clinical decision support system. It can also be used to enhance patient follow-up. For example, if you're shopping on Amazon or any online website, they have AI algorithms running in the background. So based on your history, based on your purchase history, based on what videos you watch on YouTube, Amazon can collect the data and say what could be your uh, uh, purchasing interests, right? And they can say, they can suggest you what you want to purchase and what could be according to your interest, what it could be. They can go further and say, what movies would you like to watch on Amazon Prime, or what series you want to watch on Amazon Prime. That's how is being implemented in entertainment and e-commerce industry. Coming on to healthcare, they can be used towards analyzing patients' navigation, patients' behavior on the application to enhance follow-up and care. AI when used in the right way, can enhance patients' outcomes, can enhance population outcomes. Used in the wrong way, of course, they have serious adverse complications. We always have to keep that in mind, that ethical use of AI is extremely important. So if you have any questions, please do let me know, because I'll be going into a case scenario of how we can implement mental health care and talk about it. So I'll hand over to Dr. Farid for, in
Yes,
case anybody has any questions, he'll answer. And then we'll
there
look
is,
into the case
yeah,
scenarios.
there is in the meeting chat, they have the 3 question. I will tell you because in bahasa, maybe I think you
I
don't.
can't hear you.
Oh, it's okay now, Dr. Sani? No?
Yeah, I can hear you now.
Now it's okay now?
Yes, yes, yes.
Oh, okay. There are 3 questions, and then I will translate for you. We don't need the Google Translate.
Sorry, I couldn't hear for about 10 seconds or so. Can you repeat?
Oh,
Yeah.
okay. The first question is about how we can, because of the AI, there are many tasks of the medical doctor. So we are afraid that later on, the AI will replace the medical doctor. So what is the tips, or maybe you have any suggestion how to avoid this will be happen? That is,
So,
mhm,
sorry, go on. Go on, Doctor.
yeah. And the second question is about the ethical. How we have to do, what we have to do, or what we should to do with the ethical about the AI if we implement it in the medical sciences.
Yeah.
There is the 2 question. You may reply.
Thanks, Dr. Farid. I think these are uh, important questions, and these are common questions which are put forward when anybody talks about AI and the AI's use in healthcare. So first one, in terms of clinicians or the doctor using AI or AI replacing the doctor, I don't foresee that AI would replace the clinicians. Rather, it is there to enhance their ability, enhance their productivity, enhance their efficiency by replacing a lot of repetitive tasks. AI is extremely good in efficiently managing repetitive tasks so that clinicians can focus their energy on much more much more an analytical side of the clinical care, where they are using their thinking in terms of delivering the right kind of diagnosis to the patient, right kind of care to the patient. So for the clinicians, it is a very good bonus, and AI will never be able to replace clinicians, that is for sure, because we are human beings. Human beings are very good at critical thinking. And if we are using, and there is a flip side of AI, if every clinician starts using AI for their critical thinking side of it, it is detrimental. So clinicians should be cautious, which means that, for every kind of condition, if say for example I am an ophthalmologist, I am a glaucoma specialist. Now for every image which I see of the patient, if I'm using AI to detect for glaucoma in the retina, I'm not using my critical thinking. I'm making it much more automated. I'm not using it to think critically in terms of seeing what could be the differential diagnosis for this particular condition, or what could be another sign for a different condition. There may not be only glaucoma in it. There can be other conditions also which may go unnoticed, which AI also is not picking up, right? So I, as a clinician, needs to have critical thinking, and AI cannot do that critical thinking, at least for now. Maybe in the future, yeah, but for now, yes, it is not good at critical thinking. It is not good at higher level or higher order of thought process, analysis, etc. It is very good at data analysis, very good at looking at images and saying what could be the condition. It is very good at uh, uh, doing repetitive tasks, arranging your what do you say, your roster in the hospital in terms of who needs to go where, etc., managing human resources, etc. So it is there to enhance people, enhance their thing. That's why I made sure that I write this as augmented intelligence and not artificial intelligence, which means you are augmenting the capability of clinicians. Second
Yeah.
question with regards to ethical concerns. Ethics, definitely AI ethics are important. One of the most important aspect of AI is that you develop AI ethically, remove biases, because humans, we are biased. We are 100% biased. There were few instances where somebody put questions to ChatGPT and it gave racist answers. So because the person who developed that AI is also a racist, or at least the data is racist, right? We are putting out a lot of real world data to develop AI, but in the real world data, there is bad also which exists. So AI picks up that bad, shows it as a normal thing, which is wrong, which is very, very wrong. So you need to ensure that AI algorithms, in developing AI algorithms, you have those safeguards in place. Tomorrow, it should not discriminate people from the care. For example, if I have used the care delivery which was given during COVID-19 pandemic in US. In US, data suggests that a lot of African Americans were discriminated. They were discriminated from care. If I've used the same data set to develop an AI algorithm, my AI algorithm will also discriminate against them, right? So that is an important thing to address. So people are looking at these things seriously. There are safeguards like your IRB plays an important role, or IEC or IRB, institutional review boards play a vital role in screening these algorithms and making sure that they are using the right data sets. They are removing all the confounders in the data analysis so that you are developing ethically correct algorithms. Those are important sides of it. And of course, patient privacy, data security are also important, wherein AI does not, they don't have data breaches in place. Any other questions, Dr. Farid?
There is only actually there is 3 questions, but the last 2 questions it is the same. It is about the ethical issue, and I agree with you. So nowadays, for now, the AI will not replace the medical doctor in the healthcare. But I don't know, maybe later on there is a human-like, like human-like how they make the decision. And
Correct.
also one thing that from your presentation, the most important is the data. How we collect the data, it is important. So if we put something wrong in the data, so the decision, the clinical decision will be wrong also. I think like that. So the most important is at the beginning of development of the AI is how the AI collect the data, particularly in the healthcare.
Correct.
Okay. Dr. Sani, we have only maybe 10 minutes left. So
Oh,
you may, yeah, because
no.
your presentation is very interesting. We already talked about 2 hours.
Okay.
Yeah,
Okay. So
about two
I'll
hours.
just,
So maybe you can
yeah.
make it fast, maybe 10 minutes.
So
Okay.
anyone basically who talks about AI and who has questions about AI is because we have seen rapid disruption in terms of
Okay.
technology. Like, for
Yeah.
example, mobile technology before or simple phone cameras, right? Or digital cameras. We used to have real cameras, right?
Yeah.
Where you have film, etc. But when digital cameras came, they disrupted the industry.
Yeah.
And practically everyone used to use digital camera in like 1 or 2 years. Everyone had a digital camera. Similarly, we all used to use Walkmans, etc. But when Apple iPhone came and then Android phones came, nobody uses a CD or a
Yeah. Yeah.
Walkman or an iPod, right? So technology disruption comes in. Similarly, before Google, probably people used to use MSN or Yahoo to search. But when Google came in, you had search there,
Yeah.
and people there then questions were raised in saying that why are you Googling it? Why don't you read textbooks? Right?
Yeah.
People started using Google, but people also did not stop reading textbooks. They
Yeah.
did read textbooks and journals. Similarly, Wikipedia came, people started using Wikipedia. They did not stop using textbooks. Similarly, today it is ChatGPT. You're using ChatGPT, but you should also not use textbooks. I don't say ChatGPT is bad or it is good. It is just another tool. It is just like using Google for search or Wikipedia for encyclopedia. Similarly, you have ChatGPT or any other large language model which are there to assist you. That's all. Use them as assistants. Don't make them your bosses. Otherwise, they'll become your boss and replace you. So that is the that is the whole idea in terms
Yeah.
of
Yeah.
adopting AI technology.
So it is, yeah, we are still worried about that one, the AI, the what is it, very advanced. I try to use the Chat GPT, and then the answer all of my question, and but later on I use it, and then I did not find something that is the critical. For example, why this one is like this, why this one is like that. ChatGPT cannot respond correctly. So I use the ChatGPT as as a tools. For example, I use the statistical. I forget formula. So I asked ChatGPT, yes, it is okay. Only like that. After that, I calculate by myself.
It
Maybe
is
my
very good
practice.
in coding
Yeah,
analysis. Yeah.
something that already what's it like mathematics, it is very good. Very
Yeah.
good. But
Yeah.
for reasoning, it is not too good. Okay.
There
Okay,
are
Sunny.
few humans also who do not respond
Yeah.
better than
Yeah,
ChatGPT. Yeah.
Okay, Dr. Sari, you
Okay.
will
Yeah.
continue your presentation. And then maybe Pak Dion will continue with you because I have a class after this.
Okay.
So Pak
Sure.
Dion will continue with you. Okay.
Sure. So
Okay,
case
thank you.
scenario for mental health is something which I wanted to discuss. So typically, if you look at mental health in terms of epidemiology, suicides are fourth most prevalent cause of death between ages 15 and 19 years in the world. This is a staggering number, and mental health is an area where you can use AI to, better deliver and intervene in the population. So, how early screening and intervention is crucial to address mental health amongst youth is something which we are looking at in this scenario, where you have 50% of mental health conditions beginning at age 14, which is very, very small age for an individual, and 75% of the conditions are uh, seen by the age of 24. When somebody turns for 24 out of 100 people, you are having 75 people with mental health conditions. Similarly, anxiety is one of the most common causes of mental health conditions, because of which you are losing 12 billion working days. So, which is a staggering number. And about $1 trillion is lost in global productivity because of mental health conditions. So, what are we doing? Traditionally, we've been doing, there is whatever mental health interventions we have been giving, they have limited accessibility, they also have limited scalability. But how technology can enhance these or address these challenges is through integration of technology, is through improving digital literacy and awareness through AI, through collaborative or building collaborative care models, wherein you're collaborating not only with mental health professionals, but also with technology experts, with digital technology experts, with engineers, with AI and ML engineers, software designers, and even a community health worker, as well as the people who are suffering with mental health conditions. So it has to be collaborative model, and also ensure that innovative financing is there. Any AI technology does not work if there is no finance. End of the day, every technology enhancement needs to have sufficient funding, sufficient financing. So these are the four different approaches which address these mental health challenges. How do we integrate technology? One of the aspect of addressing the challenges is integration of technology. So how do we integrate technology using artificial intelligence? You build it into telemedicine, do virtual reality therapy like a virtual reality or augmented reality therapy, which you can use as a headset and you can deliver healthcare. Similarly, all of these need to be again supervised. They should not be like, somebody designed a game kind of a thing and being implemented. Of course, these have to be monitored through a psychologist or psychotherapist. Similarly, active mental health screening is important, like a vocal biomarker technology, which I spoke about earlier, AI-based chatbots to deliver confidential and supervised support, not just confidential support, but also supervised support through a human and also human guided support. Similarly, mobile applications, so that you are continuously monitoring the patients who are suffering with these conditions and give support and intervention to them. Preventive care through AI-based analytics, not only just by looking at active screening, but also passively integrating with other health conditions and screening for other health conditions. Referral and follow-up are done through AI intelligence. And most important thing is, I would quote this paper, which talks about safe use of AI in mental health, where they emphasize on various aspects of how AI should be designed in a safe manner for mental health interventions. Similarly, financing becomes important. Financing has three aspects to it: public-private partnerships, grants and fundings through, let's say, government or professional bodies. Insurance coverage is also important in better adoption of AI tools. For mental health specifically, and not only mental health, but also for all other AI-based screening tools or therapy tools, you need to have investments from public-private bodies like companies, non-governmental organizations, micro, small, and medium enterprises, and developmental banks. Like, for example, DBS involves or funds a lot of mental health interventions, right? So they are good in that. Similarly, encourage CSR or corporate social responsibility to give more funds towards development of AI tools and philanthropic contributions from well-known industrialists, etc., for these AI developments. Use financing to drive innovations and not just the share price of the company. You need to drive innovation and healthcare reforms as part of development of any tool. Grants and fundings from government organizations and also professional bodies are important. When you say, I need X amount of money, they will not provide. You need to highlight how poor health is linked to poverty and inequality. You need to highlight how these are cost efficient, cost effective in nature. You need to show the cost benefit side of these particular tools. Similarly, the grants should fund research and community-based solutions, because that's where the large population are in the communities, in the primary health settings. So they need to be focused in that area. Implement result-based financing rather than just funding and forgetting it. So you need to seek a phased funding scenario where each phase shows X amount of result, so that your funding makes sense out of it finally. So you need to have results for each of the outcome or each of the promise you make. So that result-based financing is to be emphasized in grants and funding. Similarly, insurance coverage, so that you are advocating for AI-based primary healthcare service in universal healthcare. As part of universal healthcare, you need to make sure that AI is part of primary healthcare. Push for national health insurances to cover AI-based primary healthcare screenings and interventions. Currently, most of the countries do not fund or cover AI-based interventions as part of national insurance or public insurance. You need to ensure that AI screenings are covered as part of community level also. So as part of community level screening, you need to have the insurance to cover these things. When you do this, you are encompassing all aspects of the AI-based health intervention. So we, as part of our company, we are focusing on prevention and management area of healthcare service delivery, whereas treatment is left to hospital. So this is where it is important, wherein this covers the entire primary healthcare scenario. Finally, I'm going to leave you with this slide where it talks about how AI-based primary healthcare can be transformed. So before, it used to be, healthcare screening used to be in hospitals, clinics, and laboratories. Now, with digital health transformation through AI, it goes to where patients are, at their home, at their bedside, at their community. So that's what we are doing. Earlier, health technology was only for medical professionals. Now it becomes part and parcel of the entire ecosystem, wherein all the stakeholders are involved, right from patients to medical professionals. Patient centricity is important before. Now, because of patient inclusion, you are making patient focused products and patient designed, patient driven products. Similarly, a reference point for treatment used to be population. Now, reference point for treatment is much more personalized, which means precision medicine and personalized medicine is something which we are emphasizing on. Accessibility used to be in person only earlier. Now it is remote care, which means a clinician is sitting in a remote location and the patient is receiving the care. AI is being used to screen for patients and then refer them up. Time of health delivery used to be post hoc, which means after something happens, you are giving the healthcare delivery. Now, after digital transformation with AI, you are doing early detection so that you emphasize on better outcomes and leading to better healthcare of the person and the community at large. So that's the whole focus of my talk. And if you have any questions, I'll be happy to take them. Thank you.
Okay, thank you, Dr. Sunny, for your
Thanks, Dion.
presentation. Yeah. There's a question from Dr. Cahya. Dr. Sunny, thanks for your presentation. I'm Cahya Tri. Would you explain about what's challenging to implement AI on primary healthcare facilities?
So in
Yes.
primary healthcare facilities, I read the question. So in primary healthcare facilities, number one, if it is at the facility, what kind of solution is important is what is important. You can't have all the kind of screening tools at the facility itself. If you're doing a screening program in the community, then taking AI-based screenings, like for example, a fundus camera or a breast cancer screening tool, etc., taking them would be important. But if it is a facility where you have an obstetrician, you have uh, uh, an oncologist present, it may not be important because they can actually detect those conditions. The challenges come when, in terms of digital divide, people may not be familiar in using digital solutions. They may not be familiar in using devices, technology, right? So in primary care, that is vital. Even asking the patient to use these devices as part of a program, like a point of care device or a mental health app, which they can use to screen. We can talk multiple things on this platform, but patients may not use it because for them that may not be a priority. They may not realize that it is not a priority. So health education becomes extremely vital, where you can emphasize that AI is good. AI can enhance your outcomes. AI can detect conditions early, refer them to the right person at the right time. So these are the important things which we need to emphasize. Challenges are multiple in terms of not these are patient and provider side of it. Technological challenges are also there. Internet connectivity, the proper bandwidth of internet, server deployment. A lot of these technologies work on the cloud. So if you do not have a cloud server facility, then it becomes difficult to scale. Right. So there are multiple challenges at the technological front as well. If you are unable to integrate the device to the application, then integration becomes a problem, which means you can't run AI on that particular device. So these are the various challenges which we are looking at.
Okay, thank you, Dr. Sani. Maybe Dr. Cahya, is the Dr. Sani answer sufficient to address your question? You can unmute your. Okay, thank you, Dr. Cahya. Maybe from the participants, are there any question from you? Okay, no. Okay, maybe we'll wait for your question. And maybe I want to ask you, Dr. Sani, about the yeah. So looking ahead, what are you talking about the AI? What are the potential advancements in AI health technology that we should expect in the next 5 or 10 years, particularly in primary healthcare?
Specifically to primary healthcare, we can expect more towards disease surveillance in terms of better preparedness for things like pandemics. That is one area. Second is drug discovery is a massive thing. Drug discovery with the help of AI is going to be vital, and it is going to be the normal thing to do in the future, which means every pharmaceutical company is going to, they are already using AI, but the use of AI to enhance drug discovery is going to be the prominent thing. Clinical decision support systems are there. They will be enhanced further and further. MRI CT data so that your MRI becomes cheaper for specifically vulnerable populations such as children is going to now, if a child needs to get a CT done or MRI done, it is challenging. You can't do that for children easily. So AI technology to enhance the imaging, enhance low radiation based imaging is going to be a game changer. Image analysis and basic emphasis on clinical research is also going to be vital. Clinical research nowadays, if you are making a drug, professional bodies and IRBs, etc., they emphasize on clinical trial registration. Clinical trial data are taken for drugs, etc. They are considered, but also better emphasis is being made towards getting real world data. So now a drug may not get a permission to be commercialized when they do not show real world evidence. Uh, Clinical trial is not enough. So AI can play a vital role in that area as well, where AI is giving you real world analytics on a particular drug's efficacy and its usage in practical. So these are few areas where I see AI being implemented for the provider side of it. For the patient side, you have patient management applications where AI can play a vital role based on patient's historical data. Of course, in a secure way, it can use the patient's historical data to suggest for periodic health screening and health checkups and better follow-up of care. So those will become an important and integral part of it. So we have covered disease surveillance at the government side of it. We have covered provider side in terms of clinical decision support system. We have covered industry side. There is drug discovery, etc. And for patient, it is going to be patient navigation side of it. So these are the 4 different areas where AI can make a difference. This is not exhaustive, but these are from my mind. Yeah.
Yeah, okay, Dr. Sani. Thank you, Dr. Sani. Yeah, also from the pandemic of COVID-19, we have learned that the critical importance of strengthening primary healthcare. And in Indonesia, we are also in the process of developing a comprehensive health transformation, which includes the transformation of primary health services and the integration of AI technologies to support this effort. Yeah, hopefully that in the coming years, we will witness significant advancements in these areas. Okay, thank you, Dr. Sani. And maybe are there any questions from the participants? We still have the time for question and answer. Okay. Okay, so maybe if there is no question, maybe Dr. Sani, could you please give closing statement for this seminar?
Okay. So, first of all, thanks, Dion, for having me, and thanks to university for having me, and also for the dean and as well as Dr. Farid as well, and all the other people who have attended this particular webinar. Uh, I tried to cover what AI could do in a primary healthcare scenario, wherein we've discussed about what AI technology is and what areas it can be implemented. What are the challenges in implementations? What are the different types of technologies are there which can be implemented? And also what safeguards and ethical concerns of AI as well. So to just conclude, AI in primary healthcare is important to deliver accessible, equitable healthcare in various settings, especially in a country like Indonesia, where it's a combination of thousands of islands and where delivery of care is very, very important. So AI can play an important role in making cheaper and yet quality AI screenings in the community, and there and also by linking them to healthcare providers. At the same time, AI also needs to be looked into and scrutinized more in terms of its ethical risks. It has to be regulated and it has to be monitored. Every technology out there has to be monitored for a period of time so that there are no bad implementations of AI in the community. So, with that, I conclude and thank you very much.
Okay, thank you so much, Dr. Sani. Once again, our heartfelt thanks to Dr. Sani for your invaluable contributions. We appreciate your time and insights during this event. We hope we can continue our collaboration and that either we or you can visit each other, whether in Indonesia or in India. We truly hope for that. And I extend my gratitude to all the participants for your active involvement in this session. As the moderator, I want to express my gratitude for your participation. If there were any shortcomings during this event, I apologize, and I hope we can have another opportunity to meet in the future. And just to inform you that next week in 28th October in the in 1 p.m. we also have educational seminar from Kenya that will discuss about the role of demographic in the public health. So I hope that you can join that educational seminar. And once again, thank you, Dr. Sani, and thank you for all participants. And I will close this educational seminar. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you. Have a good day. Bye.
Okay, bye. Thank you, Dr. Sani. Oke, terima kasih Bapak Ibu yang belum mengisi daftar hadir, dipersilahkan. Oke,
Terima kasih Pak
baik.
Dion.
Terima kasih Bapak Ibu.
Berarti lanjutnya di sini discuss how about AI in Indonesia ya Pak?
Iya, mungkin sebaiknya begitu. Nanti mungkin Bu Cahaya bisa yang memberikan materi nih Bu.
Kita tunjukkan dulu.
Oke.
Oke.
Siap. Oke,
Terima
siap
kasih ya.
Maturnuun. Oke, baik. Saya izin end meeting Bapak Ibu. Oh, nggak bisa, ternyata harus host yang end meeting.
Live sendiri-sendiri aja enggak
Ya,
Pak?
ya, boleh silakan live sendiri ya, Maturnuun.